So let's start off by talking about one of your bills, which is the solitary confinement bill. Can you talk a little bit about what that bill does and why it's important to people in Rhode Island?
Absolutely, and first of all, thanks so much for having me, Hillary. So solitary confinement, which, as you know, is the confinement of an inmate in a facility for up to 23 hours a day on their own. They get 1 hour a day out. And it's an issue that's been getting a lot more attention in recent years as the public health, mental health research on its impacts grows and grows. It's been shown to lead to devastating psychological consequences, things like suicide, depression, alienation, violent outbursts, the list goes on and on. The United Nations has ruled that prolonged solitary confinement should be seen as torture, and that's exactly what we do here in Rhode Island. We have prolonged solitary confinement. It is a fact of life within the ACI, and there's a lot of folks who think that's really problematic, including myself. So we have introduced legislation this year. Our hopes is to really put a spotlight on this issue, get the conversation going. What the bill does is, first of all, it says that no one should be given prolonged solitary confinement, and it defines that as over 15 days, which is what the United Nations has ruled is over that can be seen as torture. So no one can get prolonged solitary confinement, and then it specifically identifies a few particularly vulnerable populations within the ACI that it states these folks should never be given solitary. It's no value of anyone to put these folks. So that includes folks with mental illness, and when you talk to people in corrections, they will admit solitary is where a lot of folks with mental illness go because they're not necessarily equipped to deal with people with these issues. They might not understand the rules. There are a number of reasons we put them in solitary. They already have minds that are in some way damaged, in some way vulnerable, and you put them in that situation and it compounds those issues to the nth degree. So it sets those vulnerable populations that we say shouldn't be going in, and then it also sets a basic floor on some of the humane requirements of folks who are in there during the time that they are. So saying that it shouldn't just be that you can get out more than 1 hour a day, that you need to be able to access the same programs and services and books, et cetera, that you would have if you weren't in solitary.